Hello, this is Munir Kasa. I'm an obstetrician and gynecologist working with CERT Ethiopia. My role is to improve the quality of service in reproductive health care, and I will be talking about family planning counseling. Here is the outline of my presentation. I would briefly go on the objectives and define what quality family planning counseling is, and then I will also describe what are the uses of quality family planning counseling, and also the 5 principles of family planning counseling, and we'll be talking about briefly about reproductive life plan, and finally we will summarize our session. Here are the objectives. By the end of this session, you should be able to define what counseling is in family planning, and you should be able to articulate the uses of family planning counseling, and finally list and identify the principles of family planning counseling. What is family planning counseling? It's a process that enables a client to make and follow through on their decision concerning contraceptive use. So one word to note here is it's a process, it's not a one-time activity. So throughout the client stay in your clinic, you will be engaged in counseling. And one other thing also to note is counseling is two-way, which engages both the client and the provider. Here is a true-false question for you. Practicing good family planning counseling takes a lot of time. This is a very practical question. Actually, practicing a good family planning counseling would reduce both clients and providers' time. So you don't need long time to do very good counseling. What you need to do is you just need to know the techniques and the principles behind it, and applying those principles would really reduce both yours and your client's time. Why do we need to focus on family planning counseling? It's absolutely important to have a good quality family planning counseling for the following reasons. One, with good counseling, clients can make better choice about which method to use, and if they choose that properly, then it means that they are likely to use this method and likely to use it for a longer time. And good family planning counseling would definitely increase clients' participation and also their satisfaction with the method, and they will be highly motivated, and they are likely also to return for a follow-up visit. And hence, providing a quality family planning counseling is important for programmatic aspects, because clients are using good methods and they are using for a longer term, and discontinuation rate is low, but it is also very good for in the client's perspective, because it motivates them to be part of the discussion, and they will be highly satisfied, and hence are also able to recommend the method for some other women who are in their vicinity or to their colleagues. So what are the principles of providing quality family planning counseling? There are 5 principles underlying provision of a good quality family planning counseling. You would definitely find other versions of these principles. There is this gather principle, there is a red eye principle. So underlying all these 5 principles, you can find them in all of them, and using any one of them has no benefit over the other. I have chosen this method, these principles, because these are very recent, and I found them also from CDC, and they encompass all principles underlying all other counseling methods. The first and the most important one is establishing and also maintaining rapport, and the second one is to assess or explore client's need, and then to devise the discussion according to her need, and thirdly, to work with the client to interactively to establish a plan, to make a decision on which method to use. And then on the fourth one, after you reach a decision, then you provide information that she can understand and retain about the method that she chose. And finally, you should confirm that the client has understood the method and what to do, when to return back, and so on. We will go now in detail about each of these principles. The first principle is to establish and maintain rapport. As I said earlier, this is a very important principle that you need, that starts as a client just enters the room and ends when she leaves the room. So it's not just at the beginning, but it is in the middle and also at the end. And by this, you would create a welcoming environment to the woman, so that she would be relaxed and she knows what's happening. And so it starts at the moment she enters the room, and during that time, here are very good skills that you need to demonstrate. One of them is that you have to make sure that there is privacy, that both auditory and visual privacy, no one could hear or see what you are talking about. And you should also talk about confidentiality, which is absolutely important. You have to reassure her that whatever she says would not be shared to any other person. And by this rapport, what you try to achieve is you'll try to maintain and build her trust, and also try to understand what are her reproductive goals and what are her preferences, and you have to show empathy. One very much missed portion of doing establishing a rapport among Ethiopians is lack of introduction of the healthcare provider. You should clearly introduce who you are and what is your responsibility in that clinic, and also it is very nice to greet her using her name, which you obviously have on her card. So make sure to provide your name and also address her by her name. This rapport building, there is an evidence-based communication model which is known as OARS, that enables you to provide a good counseling. So these are general principles that you should follow throughout building this rapport. The first one is to ask open-ended questions. The second one is to affirm whenever you see a positive behavior, and the corner of it, or at the soul of it, is a reflective listening, active listening. And finally, you summarizing what you have said would define this OARS model of communication. So the first one is asking an open-ended question. It's very useful to ask an open-ended questions as opposed to closed-ended question, because by asking an open-ended question, you will build a trusting relationship, and she would definitely be using her own words rather than those yes or no questions. So, for example, instead of asking, do you use contraception methods regularly, which has a yes or no answer, it's good to ask, how regularly do you use your contraceptive method? By making it open, she would explain to you when and at what conditions she's using the method, and all the other things in her own words, and that gives you a room to show non-judgmental attitude towards your questioning and so on. And she also explains what's happening, which cannot be explained by a single yes or no answer. And the other aspect of a good rapport building is to affirm when you see a positive or healthy behavior. So, for example, she comes on the day of appointment, or she has been using the method consistently for a long term, or she's any other positive behavior, she has been using consistently and correctly condoms, or any other positive behavior, then you should be able to complement that. That's so like saying, you ask really very good questions, that's a very smart decision, and so on. You have to be sure that there is something to complement before you complement, otherwise it looks like you are bluffing. So by complementing these positive healthy behaviors, then you'll be building her trust, and above all, you are engaging her or his best self, so that she would also aspire to be that positive person. The other aspect is listening with reflection, also known as paraphrasing or rephrasing. This is said to be the soul of rapport building, and in order to do this, what you have to do is you have to listen to what she has to say and then reflect using keywords. Doing this would definitely improve the accuracy of what she has said, and also your understanding of it, and it shows that you are really interested in her and you are paying attention to what she says. And it also helps her explore her own feelings, which she may not be sometimes accurate, or she may have ambivalence towards. So for example, after she has described what her situation is, you would say, so I hear you saying your husband wants to have more children, but you are not sure. Do I have that right? By saying this, by paraphrasing this, you are giving her a summary of what she has already said. So this paraphrasing has three parts. The first one is the introduction. So I hear you saying, what you are saying is, what you have told me is the introduction part, and then you rephrase what she has said, not using the same words, but using some other different words, and summarizing all. You have all the discussion points, and then by the end you would end up with a question that whether this is a correct interpretation of what she has said. Then when she affirms that, then you finish this one and you generally summarize what you have been saying. So summarizing can be done for two things. One is to transition when you have done you have finished one topic and you want to move to the next one, or it can be closing when you have done at the end of the counseling session. So the first one is rapport building, and the second one is to assess what the client's needs and her personal situation. And after assessing this, you'll have time to personalize the discussions according to her need. So in this regard, in assessing the client's needs, the most important thing is to assess her reproductive life plans. So what's reproductive life plan? A reproductive life plan is a self-assessment of life goals. People have, when they come to a family planning clinic, they don't only own, people are not only their uterus or their reproductive organs, they have some other things to worry about, their education, whether they want to go on further education, like to attend some university or to go some other training. And there are also plans in their work, in their career. There are important changes that they want to invest some time. And there is also their family planning needs. So by understanding the family planning needs in these broad categories, you will be able to know more about the client than by only asking her about family planning needs. So in this reproductive life plan, we are able to consider family planning in a broad context of life, because a couple's decision about reproductive life depends on their age. When they are 35 or 39, or when they are 19, is completely different. Educational goals, whether they want to proceed with further education or not. Their career plans, some have upgrades in their jobs or increment in their status if they continually work, and so they would take consideration of this. Their living situation, whether they are married or not married, or they intend to marry, and so on. And most importantly, financial situation, because there is a huge financial burden in raising children and maintaining family, and whether they have a social support, family, husband, and so on. And their power relationship with their partner, whether they are able to make decisions together or whether the husband is the one who's making the decisions. And also based on their medical history, if they have underlying chronic illness like diabetes, hypertension, which affects their reproductive life, and also other behaviors like smoking or using substance abuse and previous contraceptive use. All these affect her plan or his plan. So after assessing these broad areas of education, life, and family planning, you may come up to a conclusion that this couple or this woman or this man need pregnancy. Then if that's the conclusion, that what you do is a preconception care. You give them advice what to do before getting pregnant, to take some treatment, to take some investigations, and what precautions they would do. So you will not be talking about family planning. If you, after discussing the reproductive life plan, if you feel that she or he does not desire pregnancy, then this is the situation where you need to discuss about contraception. And sometimes the couple may or the woman or the man may be trying to get pregnant for some time without success, and this time it is a time to start at least investigation for basic causes of infertility. So that's what family planning is, to help couples attain their number and spacing of children. So for those who do not have children, then what you need to do is, rather than counseling them about contraception, you should give counseling and also services on infertility, basic infertility treatment services. CDC defines this reproductive life plan questions like this. The first question is that you ask everyone is whether they want to have more children or any children in the future. So if they want to have children in the future, then if they say yes, we want to have more children, then you need to ask how many children they would like to have. This is very important because some people don't know that they have control over the number of children they would have. And then you kind of ask also how long would they wait before becoming pregnant, and if they want to stay for some time, which family planning method to use, and also if they have a method in mind, then how sure are they this method would be used without any problem. I'll come later on what these problems could be. So if they want to have more children, you should ask when do they want to have, and whether they want to have it right now or to stay for some time and then have some children. But if they say no, they don't want to have more children in the future, then okay, in this case, which family planning methods would they like to use? And again, how sure are the clients about using this method without any problem? And finally, very important question is, could their plans change ever? This is very important because some couple decide not to have any more children, but later on decide that they want to have children, and this would be a cause for regret. And especially before providing permanent methods, you should be absolutely sure that this is their final wish, and usually it is good also to give them some time so that they think over it. So after building and maintaining rapport and assessing a reproductive life plan, this is now time to make a shared decision by working interactively with a client. As we already said, people have goals in their reproductive life, in their education, in their careers, and so on. But especially they could have plans. They may want this number of children in this number of time, but there are obstacles to achieving those reproductive goals. The one potential obstacle is all contraceptive methods that we provide have potential side effects, whether this could be minor or major. There is no contraception without side effects. So they fear these negative health effects of contraception, which could sometimes be out of proportion. And because they are about to use this family planning, this fear is imminent. It is present time. But the risk of unplanned pregnancy is theoretical. It is in an unforeseen future that this pregnancy could happen. So they kind of see the potential side effects more than potential side effects of an unplanned pregnancy. The other important concern that, especially here in Ethiopia, women have is about their future fertility. By using contraceptive methods, most women think that they may have a reduced fertility in the future. And perception of risk is also relative, especially it depends on past history. So if a woman has a bad experience with the contraception methods once, then she's unlikely to be confident in using another method some other time. And there are also issues of concealing contraception from either a partner or from a parent. There are some important questions that you can raise in family planning, and there are not so good questions. One of the not so good questions is, which family planning method do you plan to use? It's not a very good method. Instead of that, asking what is important to the client about the method that she's looking to use, this would give you a very good perspective. So most likely most women are using because they are interested in the effectiveness of the contraception. They want a method that works, and that works in most of the time. And so it is absolutely important that we prioritize methods with high effectiveness than those who have lower effectiveness for such kind of clients. Frequency of use is also an issue for some women. Some women are forgetful. They don't want to take pills every day because they forget. Some are very careful, or they can use methods every day. They have no problems with that. And so especially, and one other thing is return to fertility is also important. If a couple who are married recently and want to wait for 6 months are different than a couple who has 5 children and who want to use a method. So then you should also assess whether they need an immediate return to fertility or they are not bothered by it. Some methods have delayed return to fertility, especially the injectable progesterone-only contraception can reduce a significant delay in fertility, while other methods like IUD and implants do not cause a much delay in return to fertility. Once you have understood what she wants and discussed and reached a decision to use a method, then now it's time to give an information that she can understand and that she or he can retain. So what are strategies to provide this education? Now it's not counseling, this is about educating a woman about a specific method. So you should use simple language, avoid jargons which a client may not understand, and also giving balanced information on the benefits as well as the risks is very good. Benefits should usually are forgotten, include like some contraception method like pills reduce the risks of cancers, including uterine cancer and ovarian cancer, but you should as well mention all the risks associated with it. The best time to give an information is when a woman asks you a question, or when you see there is a gap in her knowledge about a method. So you can expand and give an information based on those areas, but generally be more strict in providing more information. And also highlight the most important information. Repeat that again, say that again, so that you should try to remember it. And using standard educational materials will also help you structure your information. One evidence-based counseling technique of providing information is known as tiered effectiveness. We don't need to go through each method with each client, and so the CDC and WHO has come up with this tiered effectiveness model. What it does is it divides all contraception methods into 3 categories. As you see, the above ones are the most effective ones, and the ones that are lower down in the tier are the least effective ones. So essentially there are 3 categories of contraception. The first one is the most effective ones. These have failure rates of less than 1 per 100 women. If 100 women use this method for a year, then less than 1 of them would become pregnant. So these are most effective methods, and hence this should be the choice for most women, especially those who are looking for high effectiveness method. This includes implants and IUDs, which are known as long-acting reversible methods, and also permanent methods like female sterilization and vasectomy are included in the most effective categories. The second category, these are also effective, but not as effective as the above tier. This includes injectables and combined oral contraceptive pills. These are effective, but effectiveness depends whether the client is able to use them consistently and correctly each time. And because life is messy and most women are unable to do this, they tend to fail more than the others. So on average, out of 100 women who use this method, about 8 or 9 of them would get pregnant in a year. But the third one, which are less effective ones, are condoms and natural family planning methods, and these usually are not recommended as a family planning method for clients who need high effective methods. Finally, after we have explained after we have given information to the client about her contraception, about the contraceptive method she chose, it's time now that we make sure she understood what we already told her. To do that, we use a teach back method. So teach back method is you ask at the end of the session, what are the things you said, what are the most important things, and she would explain using her own words. And it is not a test of the patient, but it is an indication of how well you have communicated to her. So this would help you evaluate if you did a good job of explaining the information that you need to do. And it's an evidence-based method of helping clients, of assessing whether clients have understood the information or not. So we use teach back methods at the end, and we can sometimes also document this on her card, whether she's able to remember essential facts. Finally, we provide the service and we appoint her for next visit. In summary, family planning is not only providing information, it's a two-way interaction between a healthcare provider and a client. Family planning counseling helps clients make their own decision about which method to use, and it also helps them to continue to use the method that they already chose. And finally, the 5 principles of good family planning counseling include establishing rapport, assessing clients' needs, helping to reach a shared decision, providing education about the method that she already chose, and ensuring understanding of the information she received. Thank you for listening.